Have you noticed some spotting or bleeding even though you have already gone through the menopause? You may be understandably worried, but let's explore what could be going on. I'm Brooke, I'm an obstetrics and gynecology doctor, and in this video we will explore what this bleeding may be caused by and what you can expect to happen next. Postmenopausal bleeding, or PMB, is bleeding that occurs after you've officially reached menopause, meaning you haven't had a period for 12 consecutive months. If you haven't had a period, and then the bleeding starts again after that, it's considered postmenopausal bleeding and isn't something to ignore, even if it is light spotting. About 10% of postmenopausal women will experience some bleeding, and whilst it might sound concerning, in most cases the cause is something benign or easily treatable. But because there are several possible underlying causes, it's always best to see a doctor for a full evaluation if this happens. So let's dive into what might be causing postmenopausal bleeding. So what are the causes? Well, one common cause is endometrial polyps, and these are small growths that can develop in the lining of the uterus or in the cervix. Polyps are usually non-cancerous, but they can cause bleeding, and they may need to be removed if they're causing symptoms. And sometimes they can actually develop into something more sinister. Another common reason for bleeding is because after the menopause, estrogen levels drop. This can cause the endometrium, which is the lining of the uterus, or the vulval tissue to become very thin. This thinning of the tissue can lead to irritation or breakdown, and it can result in light bleeding or spotting with minimal trauma to those tissues. So for example, rubbing on your trousers may cause a little bit of light bleeding. Then there's hormone replacement therapy, or HRT. Now, if you're taking HRT, especially combined estrogen and progesterone, it's possible to experience some breakthrough bleeding, especially in the first few months after you've started. It's usually nothing to worry about, but any bleeding should be checked if it continues beyond the first 6 months of starting or changing any HRT. Now, the main cause which we're looking out for is endometrial hyperplasia. This is when the endometrial lining thickens rather than thins, as we would expect it to after the menopause. This is less common, but it can sometimes lead to abnormal bleeding after the menopause. Hyperplasia can happen when there's too much estrogen in the body without enough progesterone to balance it out. And this overgrowth can sometimes be a precursor to cancer. So again, it's essential to investigate this further if it's suspected. And finally, whilst it's less common, postmenopausal bleeding can sometimes be a sign of endometrial or uterine cancer. This is one of the main reasons it's important to get any postmenopausal bleeding evaluated, as early detection of cancer can make a significant difference in treatment outcomes. But it's worth noting that only around 5 to 10% of women with postmenopausal bleeding will have endometrial cancer. And the vast majority of those, it will be at an early stage. But it's so important to pick it up if it's there. So what happens next? Let's talk about what to expect when you visit your doctor about postmenopausal bleeding. So your doctor will first start by taking a detailed history, asking you questions about the nature of your bleeding, how long it's been going on for, any previous episodes, as well as other symptoms, your medical history, and any medications you might be taking. They may perform a pelvic exam to check for any obvious causes like polyps on your cervix or signs of infection that might explain why you're bleeding. What happens next might depend on actually where you are and the local practices. In some places, they'll just refer you at that point straight into an urgent appointment at a gynecology clinic, where it might be a one-stop service. They can do all the tests and you see a gynecologist at the same time. In other places, your doctor may start by doing some tests before they refer you. Depending on where you are, the next steps may be they refer you straight into a gynecology centre, or they might arrange a common test, which is the transvaginal ultrasound. So either way, you're likely to get an ultrasound scan. Now, the ultrasound scan is usually a transvaginal ultrasound, which lets the doctor see the thickness of the uterine lining, that endometrium, and check for any abnormalities. If the endometrial lining does appear thickened, or if the ultrasound results are inconclusive, the doctor may then recommend an endometrial biopsy. So this involves taking a small sample of the uterine lining in order to check for any abnormal or precancerous cells. Sometimes this can be done at the same time as your ultrasound appointment, but often it's a separate procedure. Another possible procedure is called a hysteroscopy. This is where a small camera is inserted into the uterus through the cervix, and it gives a really clear picture of the uterine lining. This procedure is useful for identifying any abnormalities such as polyps that might not have been invisible on the ultrasound scan. And I've got a separate video explaining exactly what you can expect from that procedure. So, is there any treatment? Well, treatment for your postmenopausal bleeding will depend on the underlying cause. For vulval or endometrial atrophy, sometimes we might give you estrogen treatment, especially vaginal estrogen, which can really help make a difference to any discomfort in the vaginal area. Polyps or thickened endometrial tissue might need to be removed if needed. If hyperplasia is found, then hormone therapy with progesterone or even surgery might be necessary to prevent further growth of the endometrium. And if cancer is detected, your doctor will of course discuss a range of treatment options depending on the stage and the type. So postmenopausal bleeding can feel unsettling, but it's important to remember that the vast majority do not have a serious underlying cause. However, any bleeding after the menopause should be evaluated promptly to ensure that you get the right diagnosis and treatment if needed. If you've got any other questions or you want to share your own experience, please leave it below.